Insecure patient identification leads to medication administration, blood transfusions, and surgical operations to wrong patients, and other errors that can severely compromise the patient's health. Current patient identification systems, such as ID wristbands, only reduce errors by 50%. Concerned about this critical matter, the Murcia Healthcare Service has implemented a state-of-the-art secure patient identification system at the Oncohematology Day Hospital of the Arrixaca Hospital, the largest public hospital in the region of Murcia, with around 900 hospital beds. The hospital has decided to implement the system first at the day hospital because it is a very sensitive area where identification errors can have fatal consequences. The chosen solution has been UMANICK Identity for Health, that uses the most advanced biometric technologies: fingerprint, iris, and face recognition. The process begins at the admission desk, where the patient is securely identified by his fingerprints and automatically checked in the hospital information system. This is possible because UMANICK's biometric identification solution is perfectly integrated with the hospital software, Selene, developed by Siemens and currently owned by Cerner. Once the patient has been securely identified and admitted, he can proceed with his medical appointment. The doctor, who again verifies the patient's identity by his fingerprints, accesses his electronic patient record before continuing with the visit. If a blood test is required prior to administering the oncological medication, the patient is directed to the blood drawing room. There, he will be identified again by his fingerprints before the blood extraction, performing a secure match between the patient and the test tubes that will contain the samples. The doctor reviews the results of the blood test and decides the composition of the cytostatic medication to be administered to the patient at the day hospital. When the hospital pharmacy has the medication ready, it will be securely administered by the nurses in the medication administration room. Using hospital tablets, the nurses first identify the patient with maximum security by the iris and match its records with the medication label. The process we have just seen requires the patient to be previously enrolled. The enrollment procedure is simple and very convenient. The first time the patient arrives at the hospital, his biometric features will be easily and conveniently registered: fingerprints, face pictures, and iris. From that moment onwards, the patient can be securely identified in any area of the hospital or of the whole Murcia Healthcare Service. The Arrixaca Hospital is one of the first hospitals in the world to use this innovative technology. They are completely sure that in their day hospital there will be no patient harm due to wrong identifications. Both patients and hospital staff feel much safer. UMANICK Identity for Health benefits can be summarized in 4 main accomplishments. No more patient harm due to wrong identification. Zero fraud by patients' identity theft. Reduction in healthcare spending. And 0 second victims. By second victims, we mean the healthcare professionals involved, who also suffer when the patient's health is harmed due to an identification error.